and in those social situations is extremely important. Um, it can be really nerve-wracking to speak in front of people and meet new people sometimes. So definitely having a whole culture inside the community where people are like welcoming, and I want to introduce you and let's talk more. Tell me more about like what you guys offer. Really opens the door for um, connections to be made. Things like this where like, we met at that one networking event, we connected, we went to a couple events together down in Lubbock, where actually is where Jacob is from originally. And then yeah, we've just stayed in contact as you've been a client of ours over the last year and a half, 2 years now, and
Wow,
full
as time
circle. Just
flies.
yeah, and then you called me up and we were talking about different ways of taking advantage of the community that we have, and we just said that this might be a really great first step as far as bringing our circle of experts together so they can share their knowledge with our elite members and really just open the door for connections between them, right?
Right, because also you need to know what the other person, you only have networking only makes sense if you actually want to know what the other person does and if you can see and get more information on what they do. Just like a business card doesn't say anything. So you have to engage, and in order to also like grow the community and make the community more cohesive and also like refer to each other, you need to know what the other person does. So that's why I'm all about, okay, I need to, we need to find a way to connect that, not just meeting, but what do you do and what's your goal? What's your mission? What makes you fired up? Like what are you burning for? And that way we can partner up because I may burn for the same thing. I may want to achieve the same thing. So, and there's power in numbers. If you just if you do things by yourself, that's great. But if you can find other people that have the same mission. I mean, there are so many people around. It's just a matter of how do we find each other? And this is a forum, a platform to do that.
Absolutely. And there's a lot of different services you're able to offer through your services, right, Tina?
Absolutely. Like I can help so many on so many levels because I'm involved in so many different also aspects of health. Like that's what the topic is today, health share instead of health insurance, because the health insurance industry is, as we all know, locked up. That's why the government is still in lockdown, because of the premiums. I mean, they keep raising the premiums, and they have to because it's all about big pharma making money. It's profit motivated. That's so they have to do all these things because it's basically also the goal is to get the patient to go back to the doctor, just cure the symptoms and not cure the root cause. And so we have an alternative, and that's why also topic today, I'm very passionate about it, is having a not-for-profit healthcare that's comprehensive, that's better than health insurance. And that makes a difference in people's lives because you can choose your doctor. You're not relegated to a doctor, a McDonald's doctor who just prescribes pills. You can choose your own doctor. I mean, you can still go to the McDonald's doctor if you like to, but you choose your own. Also, your own the doctor like the treatment that the doctor prescribes. That's the treatment that you will get. So there's no insurance company that says, "Oh no, that we prefer this or it's too expensive." Here, you get what you need.
Well,
And
I'm
if the
super
specialist,
excited to dive into
right.
that, especially because about
Oh,
being like an entrepreneur and working for yourself. But back when I was working at Ford, we always had health insurance through our employer, right? So it's definitely a different game when you're working for yourself and then you have to pay in health insurance out of pocket and Cobra and stuff like that. The rates are sky high, almost unaffordable, and they don't cover much. So no, I'm really excited to kind of dive into that. I know that speaking on like, being able to help people in many different ways, Jacob also, he's our production manager. He's also a real estate agent with the Seth Brothers team. And realtors, I mean, they meet someone from every single industry. They're always working with them. So that really opens the doors to like just having those conversations about where your circle of influence is and how you can best position yourself to be an asset to everyone you meet. Um, today,
I'm interested,
go
just
ahead.
chime in here. I'm interested to hear Tina's kind of what you got to share because we actually have someone in our office that I think does something similar to what you do. I'm thinking, talking about connection, like, oh, maybe you can connect with her. She does health insurance and everything kind of works
mhm.
for herself. in the
Mhm.
Houston market. So there might be,
Right,
referral
right.
opportunities. If you can't help someone down here, she can't help someone in your area, but you know of each other, what y'all are doing, there could be some
Absolutely.
overlap there. So
Yeah.
this is interesting to me.
Yeah, and as you know, like I'm also in real estate. I know a lot of people in
Mhm.
real estate, and just connecting potential clients also with like real estate it's all about getting to know
There's so many
people,
ways to connect. Yeah.
touch points,
You
and
just
you
got to
need
keep them
lots of
up.
touch points. Basically, that's the most important thing,
So
not
many.
just one thing, but over and over in different ways. And sometimes it's like a miracle that you meet people that you already know and you didn't know that you know them. So it's like, wow, how did that happen? But just because somebody introduced, they or
You
just
never know how
read,
things are going to fit together.
right? Yeah, absolutely. It's like a big puzzle. And then you get that magic piece that's missing, and all of a sudden, because of somebody refers you or somebody connects you, then it's all perfect. It makes the picture complete. So, and
And
I
that's
look at
absolutely right. I know
as
that
weaving, right? It's like kind of weaving.
definitely. I say we got my buddy Gabriel on here as well. We actually met at a pub up here in Michigan. And we just really hit it off, started a relationship, and he's like, dude, I love what you're doing. I can definitely share this with people. And so he's gonna, start representing us just throughout his daily life. And, word of mouth referrals, most effective, incredible way to bring on new business. So I'm really excited to see what that brings. It's good to see you on here, Gabriel.
Hi, Gabriel. Good morning from Austin, Texas.
Yeah, so I'm also going to say if people want to, they can put their name and phone number in the chat so that other
Yeah.
people can pull it and stuff at the end. Um, we'll also um, have people comment or put in the chat just saying the word networking if they would like to be pulled off in the breakout rooms at the end of the conversation. Boom. And then, yeah, so we're just going to kind of get the ball rolling. I'll do the quick intro, which we kind of did a soft introduction already. And then kind of go over what today is going to look like. And we'll jump right in for Tina in about the next 3 minutes. So we already talked about how we met, Tina. I'm so excited to have you on here today for the very first time. There's going to be many
Okay.
more. I hope that you're going to be a part of the ones in the future as well, bringing on more people from our network to be able to share what they offer, and kind of allow for more connections inside of our community. Um, Tina is going to give us a full overview on health sharing, and the differences that are going to come here with open enrollment for health insurance, and kind of how we can position ourselves to best move forward in these new times. I'm going to give everyone a very cool little tech tool that they're going to be able to save to their phone and use from this day forward. It'll be a free tool that you get just for using it. And then I'll also do a quick overview on a very awesome AI note-taking application that we use. We did not create, but we use. And you'll have a referral link and stuff in there for you as well. So without further ado, Tina, I'm going to stop sharing and I'm going to hand it over to you.
Okay, awesome. Good morning, everybody. I'm glad to be on, and thanks for our masterminding that we got this started. So Nick and I, we always mastermind when I'm driving, because I'm driving. My background is I'm German, born and raised in Germany, just real quick. But I love Texas. Texas is my favorite country because I love freedom and also entrepreneurship and no limits. And that's what we can do. That's what like all my circle, my tribe, that's what we're in health and technology. So those are the main that's our arena, health and technology. So I'm on the road a lot. And that's when we have time to mastermind, Nick and I, so I have time to talk, and that's how this brainchild came about. So today is our first networking, and I'm going to present the topic of better healthcare because pressing topics. This is an open enrollment is going to start November 1st, and the premiums will go up by at least 35%. It's approved for Texas. They will go up 35% plus more because we still have some government issues. The government is locked up because of the benefits that Obamacare had back in the day when COVID was still around, but now there's no more COVID, so there's also no more actually reason why the taxpayer has to pay trillions of dollars and support. So we're looking for other ways. We can't influence what the government does, but we can influence our choices. And Impact Health Share, that's the choice. And I became a member 3 years ago, and I'm saving $6,000 to $8,000 a year. I have so much better care because my sons and I can go to any doctor that we choose. There's free checkups, free labs, free telemed. So from anywhere you go, you can always call the doctor. You get your prescription 70% off. The bills are repriced. So those are just like some of the top things that really piqued my interest. And I've been using them. There's a holistic credit because Impact is not for profit. That makes the big difference. Impact Health is not for profit. And you can choose your lifestyle, what fits best into your lifestyle. That's also your health choices reflect that. And the bottom line is they support you on your health journey. So chiropractor, IV, whatever, like this, gym memberships, all that, you can get holistic credit for that. So you get rewarded for being healthy. And there's more perks to come because again, there's no profit motivation. So we have assets in the future, so more than 1 year in the future. So that money is not just going to sit there, but it goes back into the membership. So dental and vision, it's all included. There's more perks that you can do home testing and also, of course, the blood testing, you get like 70% off. So again, there's a lot of perks, and I'm going to show you how this is done because how the nonprofit works and how the sharing works. So let me just, also talking about sharing, let's share the screen. Okay, and get going here. All right, okay. So the name of the company is Impact Health Share, been around for 6 years. And let me show you what it is.
So you just saw an example of how health sharing works. Simply, people helping those in need. Here at Impact, we're slightly different as we use a proprietary decentralized technology that allows the transfer of monies through a secure digital payment system. That means all the sharing happens seamlessly from members to the share account of the member in need.
Okay, so we also have a group. Please take a picture. You don't have to be a member, but this also, the Facebook group, we are on a crusade. We're on a crusade to share this because we don't advertise. We don't put money into advertising. It's all word of mouth, referral based. And we also have a program where you get paid for referral. So that's how we share, because this is also the best way within the community. Again, the community work, the networking. So please take a picture of this and just join the group and you get more information. So the truth about healthcare, I'm just going to go like over this real quick and sum it up. The truth about healthcare is that about 90% of the people pay for the 10% that are really sick. That's in health insurance. So you always overpay if you're fairly healthy or if you're healthy. So in the cost of healthcare are through the roof. And typically in a household, the number one liability is healthcare, car insurance, mortgage. So it's all the way up there. And then also medical bankruptcy because of medical bills. That's a truth and a reality here in the US. So we're looking for ways of how can we remedy that. And this is definitely a ways because we have low monthly costs, more affordable than any traditional health insurance, up to 70% less than traditional health insurance. And again, the medical freedom. So that's what stands out. And so it feels like insurance, but it's not. So that's what impact is. You have your insurance card. It acts like also like a commercial insurance because the doctors have to take it because we have the EADI payer ID. There's no religious requirements. That's also powerful because health share has been known for a way to help the sick people in churches. But the problem with that is you have to be a member of that church. You have to be endorsed by the pastor, and that's no religious freedom because we have all kinds of different creeds in our society. So we are the first ones to take that concept of the church member-centric, everybody helps each other when somebody gets sick, to the next level through technology. And that separates us from any of the other programs. And we've grown more than 10,000% because of that, because people want to help people and see the power of that. And again, no profit motivation, which is unheard of in healthcare, basically. So how does it work? Because a lot of people are like, okay, what does it cover? Well, we're fully comprehensive, and we cover all major and minor incidents, health incidents, illnesses, accidents, injuries. So it's all covered. There are some regulations about pre-existing conditions or anything that happened within the last 36 months, but you can still be a member. Like even if you don't, and you get the repriced benefit of 70%. We have a lot of members using that. Even if you had like a pre-existing condition, you can still be a member and save a lot on your bills. And that's even also on the RX, because we have RX for up to 70% less. It's the real-time pricing, which also shows you how much we overpay through big pharma, through all these other outlets, because everybody wants to profit participate. And this is different. So, and I'll give you an example of a quote. Nick will put the link in. So, and please save that, or contact me, on how to get a quote, because it's also very simple. And one of the components for the quote is the primary responsibility amount. That means it's the annual amount for you or the whole group. And it's also what's different here. You don't have an insurance that's called premium. So the premium, that's what you pay out of pocket. Here, it's a little different because until you reach, and there's 2,500, 5,000, 7,000, and 10,000. So depending on the lower monthly, what you pay monthly, but as I said, like I'll show you, you have your PRA. And once you've reached that, the whole group shares. And that's the thing. The whole group shares your bills. Okay, so just like a quick overview, it's not insurance, but it's better than insurance. So no provider restrictions, comprehensive healthcare, no utilization reviews. And that's what I referred to as, okay, the doctor has the freedom to decide, not the insurance company. So they can't question what the doctor said. So you get clearance for whatever treatment is needed. Year-round enrollment. At the last day of the month, you get insured, you can be covered on the first of the next month. So last day of the month till 5 p.m. I don't recommend that, but it goes month to month, and it's also not a contract. So in case some members move or have other issues or have insurance that they have to have, then you can there's no restriction. You get your money that's in your account, you get that back. So that's also unheard of. You can see it's so transparent. You see what money you have, what money the whole group has, how the money moves. So it's all transparent in your back office. Then the telehealth, 24/7 telehealth. Anywhere from the US, anywhere you go, and then you just get like your doctor's prescription sent to the pharmacy that's close to you, that you choose, and then you're covered. And I use it all the time. I love it. And also the complimentary annual well visit. So that's another thing. You get a free health checkup, free labs. So again, we want to see that you're healthy, that we are healthy. Then also the RX, dental vision, all of that included, and the community support, and then the holistic credit. Those are the main perks. Another perk is, as I said, I travel a lot. I go to Germany. So if you leave the country, you still thing happens, you have to pay up front, but then you get rewarded when you get back and supplied. So also one last point that stands out, you don't have to have a social security. If you have an ITN number, you can become a member. So there's no restriction on that. And it's not just for individuals and families, but also for business owners. They can help their employees get better care for less money. We have a lot of business owners, they're putting the money that they save, incredible savings up. Like we had just one in Dallas. They save up to $10,000 a month for about 11 employees. That money, the $10,000 a month, they can put back into their business. Or if you also, as a family, you can put that money back into your family rather than give it to the health insurance company. So this is just like some more details on the health insurance, on the wellness award. And again, here, this is the overview of what's the best fit: individuals, families, entrepreneurs, people that are self-employed, also service industry workers. Usually they don't have coverage. Seniors as well. So if you have plan A and B, you can have this as an impact as a supplemental. And then again, small businesses. Those are the main groups that then we have the guidelines. So it's based on the guidelines. It's very simple. There's no 300 pages of small print. This is like 3 pages, and that explains everything. And this is just an example of also different bills, how they're repriced, because the way it works is you go to the doctor, you show them your impact card, they connect with impact, so the billing is set up. Then the bill will be sent to impact. The doctor gets paid within 18 days, which is also unheard of in the health space, because usually doctors have to wait. I know friends, doctors that wait like half a year or even more. So they get paid within 18 days, and your bill will be put into your account so you know how much you pay, and then that's what you pay. So you pay the reprice bill. That's how the repricing works, because it's the fair market value that's paid. So all these, like, there's a lot of things in the health insurance industry that behind the scenes. So we are very transparent. We don't have that. And as nonprofit, so that's why we can reprice. And this is another bill where it's called reference-based pricing. So this person had to go to the hospital. It was a bill of $121,000, and it was repriced to $2,830. So that's the real-time value. And again, there's many more examples. I'm not going to get into that. Now to the quote. So the way a quote works, to how to get a quote, and I'll put that in here right away. So what it's based on is not on how much money you make, but who is the oldest member in your household. So the birthday is the factor that determines how much you would pay monthly. And of course, the members of the family. We have families, it's 3+. So how many members does a household have? And you get the result immediately. So you know exactly what you can choose from. And let me just get to that and share that. Okay, so this is how to get a quote. You put the age of let's say this is just an individual. Let's say the birth date is the 30th of April. So that's my friend Jake, 1996. Okay, so it's just one person. And let's do 1. And then we get the quote. And then the quote. Okay. Let's click on the quote. Do we have all the details? Okay. Oh, okay. First the month. This is the German the German way. Okay, we have to have the month first. So that's April. And then we go 30th. Oh, we need to go back. Okay, there we go. Okay, so when you don't put the right information, the birth date in there, it can't give you the result. So now this is the result. So on the left-hand side, you see the annual deductible. On the right-hand side, you see your monthly. So depending on how low or how high the primary responsibility rate is, your monthly will be. So 2,500, you would pay 246 a month to get the full coverage. But and until you reach the 2,500, you pay the reprice bills, and then the co-share 10% of 5,000. And after that, which is called insurance terms, you have that too. It's co-insurance. Here it's co-share. It's a 90-10 split. But after 5,000, that's the cap. All the bills are covered. And especially when you have a family, I always recommend to have the lower one, because also with the holistic credit, you can deduce $1,800 out of your 25. So you reach that goal that everything is covered much quicker. If you never go to the doctor, and I have lots of also friends, family who use that because you don't go to the doctor. You're healthy, you take care of your health. So, but you never know what kind of events can happen in the health, in car, whatever accident, God forbid, but you never know. So you're covered by just paying $102 a month for like, and 10,000, everything that's above 10,000 will be covered in, even like from the first day you are a member. So this is how this works. And then if you like to do your quote, I'll send you the link, or we have the link in the chat. So and then we can go from there, and I can give you more information, because I think we're about to reach our time. Let's stop sharing and see if there's any questions.
I actually have a question.
Okay.
So I kind of have a complicated situation with my household. Sorry. So I have tribal coverage, so I can go to any tribe and I get basic, checkups and all that stuff, but no major medical. And my
Okay.
girlfriend, she works in the medical field, so they offer her insurance. So how would you implement something like this when there's already coverages there? We're not married, so I just, you know what I mean? I don't know how, and we do have kids, so.
Okay. Okay. Okay, I see. Well, you can be a member, so there's no restrictions on the membership. So even because we have a lot of members, also they have some basic coverage through their employer, but they like the holistic credit, and you can become a member. You can do also a lot of the coverages. For example, if you're in a clinic, like where you have like the small, there's a term for that, but you have like a doctor that helps you with your monthly, so it's like $300 or like 250 or whatever the price may be, but then you're not covered for major medical,
Right.
and that's why this is a case where I would say, like, okay, just cover, and if they're your kids, they're part of your household, so they're covered with you. And you can add, like, if it's 2 kids, you're 3, and then every other member that's part of that group is included anyway. So you don't have to pay for each member. So it's just it's the group. It's always the whole group. And once the group reaches the annual deductible, then all the bills are covered. So there's no restrictions on that.
Okay.
So it could be like, you could, in your case, you could use it like a supplemental type thing.
Okay, perfect.
So
Cool.
even though it's not a real supplement, but like just to make sure that everybody's covered, because with kids also, if they do sports, I've seen that a lot.
Right,
With
you never know what'll
parents, like,
happen.
oh, my kids are good, but then okay, they broke one boy broke his arm. Okay, then that's like 200,000 if you have, like, depending on the space you're in. I mean, typically, like, my son broke his leg, it was 250,000. I couldn't believe that, and that's why I also got into that was a couple of years ago. And I was looking for other ways, and that's how I found Impact, because, like, I'm not gonna have that, craziness, and also the worry, like, how am I gonna pay for that? So yeah, definitely. Yeah, and you can, I wanted to put my number in the chat, but let me see, let me put my number in the chat. So
Yeah,
that
thank you,
way,
David. That was a good question, man.
yeah. Okay,
Perfect.
806-577-7903. So that's my number. And you got my link, right? Link, you put the link in there. So
Yep,
yeah.
I put the
So,
contact link in there as well. So definitely,
yeah.
save her contact, connect with her, with Tina on there. That was a really informative presentation. I really appreciate that, Dean. I definitely see how, for entrepreneurs and such, if you're not being, if health insurance isn't being paid by an employer, it's definitely something to consider.
Absolutely. And even again, like employers, if you have your startup and you have a couple of people working for you, you can save so much money and give them better care. And that's also something, again, we have to share with word of mouth. And yeah, if you're also interested in how to do all that or know people that are looking for helping sharing, you get paid for that. So we have also like a referral program that's pretty powerful.
Hey,
I have
Tina.
one more. Oh, sorry, dude. You go
Okay.
first.
Okay.
Okay.
No, appreciate it. I'm just curious if you've heard of Better Health. Oh,
Yeah,
sorry, I got a call. Give me
yeah.
1 second. Gabriel, if you
Okay.
want to do your
Well,
question.
actually, I think William had a question in there as well.
William,
William, did you
Yeah,
have a question?
yeah, I
what
did.
you?
So
And
Tina,
quickly introduce yourself.
oh yeah,
Okay.
my name is Will. I have a company called BSG Connect. We work with high ticket coaches and consultants and help them to succeed. But the reason I'm asking this question is because we actually have a lot of alternative healing people within our
Mhm.
network, and
Mhm.
this would probably be super interesting to them. How
Absolutely.
is there a way for them to kind of apply to be a provider, like on the
Yeah.
network,
That-
or?
That's a great question. Let them connect with me because we also like on our portal, we have a referral, like which doctor, when you're looking for a doctor, when you're looking for a practitioner, you can put that on the portal so people can find you easier. And then also we have like we're very group oriented. So like in the Austin area, there's also a lot of people that like have the non-traditional treatments, offering non-traditional treatment, and it's something that helps everybody. It helps the practitioner. It also helps the patient to you go that route. And since we support that, we just need to work together. And then there's so many different ways we can help each other. So yeah,
Yeah,
just send them
and
my way. That would be amazing.
there's even a lot of allopathic medicine doctors that are going to a monthly subscription model as well. So
Right,
yeah, I'd
right.
like to talk to you more about that. I'll click on the link there and I'll get you my information.
Yeah, and then
Yeah.
or just text me. You have my number. Just text me.
Yeah,
That would be very cool.
Hey,
Okay,
sorry
let me.
about that, guys. I'm currently at work, just off joining in, so I'm kind of back and forth right now.
that's cool. Thank
That's
you, Tina.
fine. We know what that is.
Yeah,
Thank you, Will.
yeah. I was like, I can join, but I might get pulled away. So
Yeah, right.
No, you're good.
So,
We'll break up into breakup rooms in just a little bit, but I'm gonna share my screen, give you guys the quick two tools that I was talking about. One is I'm gonna put the links also into the chat. That way they are there. And then I'm gonna share my screen. The first one, many of you guys probably already heard of. It's called Otter. I think it's absolutely fantastic for taking meetings on or taking notes on meetings just like this. Anytime that it's web-based like Zoom or Google meetings and you're not going to retain everything that's talked about. It listens and transcribes the entire meeting for you and then opens up and gives notes on everything that's going on. So like right now you can see the live preview of actually the of my screen. It'll take screenshots kind of throughout the conversation or throughout the meeting and reference them in the images. And then what's really cool about this too is at the end of the conversation, you're able to actually ask questions about the meeting, and it will be able to pull those details straight from the transcription or even the summary. And it's just a really helpful tool because we're not going to retain everything we talk about. Especially like if you wanted to go and pull that one QR code that Tina had on her screen for a few minutes for the Facebook group, right? We can't always go back in time, so being able to go and find that image, which I'll probably share a link to the summary as well as putting it in our newsletter so that people after the fact are also able to go and connect to that Facebook group if they choose. But this is, it's really extensive on even the free plan, which gives you like 300 monthly minutes, which I've done, 15 or so, 10 to 15 meetings this month that have been summarized, and I've only used half of that limit, you know. So that's definitely one of those tools that has a really great freemium option, and you know the value is there. I'm curious, has anyone else used Otter or anything like it that they really liked?
I've never used it, but it looks really awesome.
Yeah. Especially that you can also save the pictures, because that's a lot of times when I'm in a Zoom, I'm like, oh, I should have snapped, I should have taken the bit, but then the slide is already, it's the next slide, and I missed that one slide. So that's a great tool.
Absolutely. And actually, with the link I put in there, the referral link, like I said, the free option is fantastic, but I think when you sign up, they give you the pro for a month for free, because it's a referral link. So definitely, you know, take advantage of that. The second link I put in there is to this event maker. And I'll put in a quick example event, but this is kind of what it looks like. You're going to be able to save this link to your phone as a web application as well. I don't know, can you guys see this square with the upwards arrow in the top right corner? I'm not sure if that's part of the screen share or not.
Oh, let's see.
Right here.
I mean, that's
Yep.
like the share, it's the share
It's a
icon.
share icon.
Right.
Well, on your mobile devices, it'll be at the bottom center if you're using Safari. It'll be in the top right if you're using Chrome. And then when you click that, there will be a button that's not here on my computer, but on your phone that will say add to home screen. And
Okay.
when you add it to your home screen, then it'll populate there as a web application. We'll also put that in the newsletter that comes out, but then you can save it and you can use it anytime. And so when you want to create an event that you want to share with multiple people and you're not sure if they use Google or Outlook Calendar or what have you, you can create it on here, optionally put the meeting link. Like that's what we had done. Set the duration, but it doesn't really matter. 20. Set the time zone too of when the meeting will take place. So if you said 9 a.m., just understand that if you pick Central, it's going to be 9 a.m. Central time, and then whatever people's calendars, it'll auto correct too. So if they're on Eastern time zone and I choose Central, it'll auto correct to 10 a.m. when they add it to their calendar.
Cool.
Right here, they're able to click generate event. And this is kind of what it will look like with the meeting title, description, the date and time. Description down here. And then they're able to just add right to their Google Calendar. They can add it to their Apple Calendar. And then if they just want to share this nice UI page, they can copy the link. And so you can copy this, paste it in an email, paste it in a text message and share that. And that will stay until 2 weeks after the date of the meeting has taken place. So this will maintain its integrity so you can share the link a million times. It will always be accessible. Or you can share it straight from here via text, email, what have you. But that's a little tool that when we were setting up for this first event, I wanted a nice, easy link that was calendar compatible for everyone. And it was something that we created specifically for this that now I wanted to share with you guys. And I'll just show you. You hit add to Google Calendar. Boom. And it'll create the event with the title, put everything in the description, duration, set the time zone. And all they have to do is hit save and it adds it right there. Also, if you put a meeting link, it goes right in there as well.
Is this what you used to create this event?
Yeah.
Okay, I like that because I just clicked it, saved it in my Google Calendar, and it was flawless.
Yeah, that I've been looking for something like that, because sometimes then you have to copy paste the link and then I don't find the link, and it's just they send you an email and then you don't find the email because it's deleted or in the trash. So it's like when you have to look for the connecting, that's always last minute, then you don't make it, like sometimes
Yeah,
it's like,
exactly. You're like, oh wait, I gotta go, and then something happens.
Exactly. So this is a great tool, actually. Yeah.
Fantastic. Now I'm sharing my screen mirror right here on my phone. Do you guys see my phone on the screen or no?
No.
Okay, it seems like it's not going to allow me to share it on the meeting, but I put the link in the chat. We'll also send it out in the newsletter as well, so you can add it. But remember, all we do is we hit the share icon, and then there will be a button that says add to home screen. And that will add it as a little app icon, and you can move it around. That way, it's easy for you to find at any time, and you're not searching through like, our emails to try to find that link when you actually need it. Might as well put it where you can find it, right off the bat. All right. Well, Tina, I really appreciate you taking the time to do this. We're gonna kind of open the door for people in the future to I'll have you reach out to them. I might put you in connection with a couple people to offer them some time for 20 minutes or so to come on, talk about their business, and we'll kind of make this like a monthly thing, I think. And I'd
Okay.
love to have you continue to kind of host it. Because I think that, when you can have someone, a partner to many hands make light work. Um,
Absolutely.
I,
Yeah.
I really value that. And
Right.
I value your time.
I
But we'll do this.
appreciate you and that we did the mastermind in the car. That's like 3 weeks ago, and we always come up with something. And I also like you're the author and all these things. I would never know about them because of you. You're just like sharing that, so that's great. Thank you
Absolutely.
so much.
And here, why don't we do a breakout room? And at the very least, William, would you like to talk to Tina one-on-one a little bit? We'll put you guys into a breakout room there. All right, perfect. Let's see here. And then Jacob, I'd like to introduce you to Gabriel. So I'm gonna put you guys in a breakout room. We'll be actually, Tina, would you help put them into a breakout?
Yeah, let me see. Let's get the breakout rooms going. So where are my breakout rooms?
I feel like I'm learning a new thing. I'm so used to the Google meetings, but these are actually these are a lot better. Ooh, assign manually.
Right. Let me get
Two,
to the
create,
breakout rooms.
and one. I figured it out, so I'm right here.
Okay, because you can assign manually and then
Yeah. Or you can do randomized. Yep.
yeah. Did you figure it out, Nick?
Yeah, but I can't assign you, Tina, so you might have to hop in there.
I can jump. I think I can jump in and out.
Co-host or host.
Perfect. Well, I put him into room 2.
So I can go,
Were you able to jump in there, Tina?
let me see. I should be in room 2. Let me see, but I don't see the room 2. You can't move me.
I don't
Let me
see
see.
you on
Should
there.
have access. I can open all rooms and then I guess then I can jump in. Let me see.
This meeting is being recorded.
Well, hey, Loom. I think that's a pretty good first meeting right there. Room 1.
I am now in a breakout room, but I might be in the wrong one.
What's up, guys?
Seems like we all got to the breakout room.
Travel.
Nope, there's not everybody's on this in there, so somebody else is in a different.
Yeah, we're missing, I think, Jacob.
Jacob is in his own room.
couple other ones. Yeah.
I mean, that's the thing about those breakout rooms. I always it's like a miracle to me. Like, how does it work? And it's like the time travel, and then you end up in the room, and then how do you get back?
Yeah.
But
We teach that's something we work on with our clients all the time is
right
how
when
to
you
manage
close the
this.
room, then everybody's back. That's the and for some reason it just shows one breakout room on my end. So maybe it didn't sync, Nick. I think that may be the thing. But yeah, so yeah, obviously we need some more training. So whoever can give us the training, that would be great.
Oh, I can leave breakout room. It's going to close in 56 seconds. So 54, 53.
Okay, then I guess that's going to take us to the main room again.
Do you use Zoom often, or do you typically use Google Meetings?
Yeah, we
This
use
meeting is
Zoom
being recorded.
pretty much exclusively, where I was pushing our clients to go to Zoom, because what I'm doing is I'm training them on, how to present and utilize flow. So that way they're not, hunting around for the big
Business Synergy Group Connect is committed
around for their slideshow and screen sharing and stuff like that, right? So and
Okay.
they don't lose connection, right, with the audience, because they're on the same screen as their slides, right, instead of the little talking head in the corner of Zoom. So the system I use to do that, or the systems I use to do that, work best on Zoom. So that's so yeah, we work with Zoom, do the breakout rooms, and teach them how to do it. We train them on how to save the chats. We have special tools for that. You know what I mean, and all the other stuff. So we just we want to create flow, because everybody's got great content, right? But you have to have flow and delivery if you want to actually create that engagement. So we teach that
That's
to our.
cool. I'd have to take some practice lessons with you.
Oh yeah, it's fun. It's fun
So
stuff. And
what's your number again, William? Let me just write it down here.
yeah, sure. It's 208-469, and then it's 4797.
4797.
Mm-hmm. Yeah.
Okay, awesome. Yeah, I'll reach out. I mean, yeah, because I exclusively use Zoom. So, but usually with the breakout rooms, I mean, somebody else does it. So, but I want to know myself. That's the thing. You're like that, and also that's why we're in our community. We want to be self-reliant. We don't have to I mean, we learn from each other, but that's how we grow. And so we
Yeah.
can do things.
Well,
And
you
I
don't
mean,
want it to be
it's very simple, right? But just
right.
you need to know those little tricks and hooks and
Well,
right
the other thing
details.
is you want it to be duplicatable, right? So, like, if you
Yeah,
have people that are kind of like on your team, most insurance is set up like that. Well, they
right.
want to be able to duplicate the process. So we have to keep it. It can be effective, but it can also be very simple, right? And so that's kind of the thing that we go for. Like, you can get a lot crazier than what I just showed you, right? But at the end of the day, like, do you really need like sound effects and poppers and like congratulations and spinning wheels and you know what I mean, to give away prizes? Like, yeah, you can do that, but we teach you the basics. We keep it nice and clean and professional, and give you the opportunity to connect with the audience in a meaningful way, right? So it's
Mm-hmm.
so,
That's cool. And again, like because yeah, we want to be effective and duplicatable too, because we want to get
yeah,
the
yeah,
content across in an effective, duplicatable, simple way. And like you said, I that totally resonates with me because I can't do everything, but I need to be like the perfect example so I can teach my group or the people that I work with so they can do the same thing and
yeah.
empower them. And so they can go out and do the same thing. And that's how we reach much larger groups. And that's why this is like like a direct way of not marketing, but sharing, because marketing is like it's kind of more on the surface, but this goes deeper, right?
Yeah, this is the authentic connection that everybody's craving, right? Because like at the end of the day, like there's so much AI and there's so much other stuff out there that
Yeah,
people they're losing connection with their audience. There's so much noise between, you know what I mean? There's
absolutely.
so much noise between their message and them, right? That they can't really it's difficult to connect, right? And so that I always tell
Yeah.
them, so it's like, hey, here's you, right? So like I always do that type of stuff where it's just like, I'll get on here and I'll go, okay, well, here's you, right? And then
Mm-hmm.
here's your ICP, right? And then
Right.
here's everything else that's between you, right? So ads, all the other stuff, all the competition, everything like that. And so if you can't connect to your audience because there's so much between you and them, then you got to find a way to cut through the noise, right? And so
Mm-hmm.
that's what we do, is we help people to find their voice, connect authentically, and then systematize everything else so that way they know, right, how to connect. But I'm really interested to understand a lot more about what you offer, because we have a lot of consultants and coaches in the healthcare space that probably don't, either maybe they've heard of it, but like I don't know that they're actually actively pursuing this as an
They
opportunity.
could also share this, right? That's the thing. Like
Yeah.
it's duplicatable and it's very simple. But again, like it needs people to share. It needs a community to share. And that's also our concept. We don't want to do marketing and advertising and all that. It's the authentic sharing. And and I worked in television for 20 years, so I know all about PR marketing and now with AI, like you said, you don't even know who to trust anymore, like because it could be just manufactured and so it's not real. And that's something, you know, I mean, yeah, there's people that love that, but like I don't think it's authentic, and I want to get my message across in an effective way and not have to like, you know, get lost in all the stuff. So just let's keep it simple. And that sounds like you have we definitely need to talk and continue our
Yeah,
conversation.
the great thing to identify between you two is, you know, ensuring that the people within Williams' network that offer those homeopathic medicines and offer those different services, if they can accept your health share as payment for those services, where like a lot of insurance companies would not pay those companies, right? So
Right.
And so
I'd be
they're stuck where
interested in
they're
knowing
at,
about
right?
that.
Yeah, a lot of these providers are stuck where they're at, where they're like, hey, you know, I'm trying to charge like a package price of like $2,000 or whatever. Like a chiropractor
Right.
might have like a package price of like 2 to 3 grand, and you know they're using financing options that are just ridiculously expensive.
Exactly.
And nobody
Yeah.
can qualify it for it because they have to have like 700 plus credit. So it really limits the scope, right? Like the opportunity for them. You know what I mean? And so customer acquisition, everything goes up, right, with that. So, you know, if they have a simple way to, you know, provide, and we have a financing partner through us that we utilize that we've been very successful, you know, with regard to installing it and like helping them with that. But like,
Mhm.
quite honestly, like, because we use it for our coaches, but quite honestly, like, you know, it would be even better if they had like, you know, some sort of health sharing program installed as part of their thing. Does it take a minute for
Well,
them
here, real
to
quick,
like go
there
ahead?
is no time like the present, and you guys definitely have a lot to talk about. So
Yeah,
I'll move us into a separate breakout room, let you guys finish up, but I'll just wrap up right now saying thank you guys so much for your time and thank you for joining us today, and loved your questions and your input. I love how engaged everyone was too. You know, that makes me feel good, and you know it's all about that,
absolutely.
those simple interactions, and we'll have more in the future. So I'll let you guys communicate a little bit more, and thank you so much.
Thank you so much, Nick. And Otter took care of, so we have the recording, we have everything in place. So this was an amazing kickoff to like many more of these and much bigger. So again, like we start small, but we'll grow like really big.
Thank you, Tina.
Absolutely.
It was nice to meet you.
Thank you.
Nick,
Nice
thank you so
meeting you
much for the
all.
invite.
And
Thank you for
Gabriel,
the invite,
Cool.
man. I really
So
Will,
appreciate
and
it. Great
Jacob.
seeing you again.
I'm moving us to room 2, and I'm gonna leave Tina in there. I'm not sure that works for the host, but we'll try it.
Okay, we're playing with it. Let's play with it.
Yeah,
Yeah.
play with it.
Yeah.
This meeting is being recorded.
Yes, we're in room 1.
Yes, we did it.
Yay.
Sorry, man. I didn't mean to monopolize everything. I'm just really curious about this. So like, does it take a minute for like, say, you know, chiropractor gets a patient in and they're like, hey, yeah, I really want to do this, but I don't have the money or whatever. Is
They,
there like a time frame? Like if a patient signs up for it, like could they come back like the next day and like use the service, or is there like a
well, the
waiting?
thing is, yeah, you pay the chiropractor, and the Texas Chiropractor Association is also member of what we do. So
Nice.
so you basically, until you reach your deductible as a patient, you can from day 1 you can get, or day 2 you can get your chiropractor appointment. So it doesn't take any like time frame, and
Oh,
you
so it's
choose
like
your
a reimbursement model. Then you pay the full price, and
You
then
pay we pay the repriced bill. And that depends on the chiropractor, because they have different pricing methods, and so they get compensated. But you as a patient, you will have to you pay the repriced bill or the itemized. They give you like a special deal, and then you use that toward your PRA to your deductible. And so you accumulate the bills, and then once you've reached your deductible, then that's why I said the 2,500 plus the holistic credit. So you reach that deductible very quickly, and then all your chiro practitioner up to 50 hours of chiro will be covered in a year. So that's quite a bit. So you can have your regular chiro meeting, and once you've reached the deductible, then you get it. It's all covered by the group.
Gotcha,
So
gotcha.
it
So there's
just
a
takes a
little bit
little
of
time to build it, right, to
build
reach the
it, yeah.
deductible. But again, once you've reached it, then it's all covered. And even if with chiropractors, they typically can work with them. They give you like a special rate for that. So and then
Yeah,
as a
usually there's a
chiropractor, right?
yeah,
It's
usually there's a thing with that because like I know for like the naturopaths, like a couple of naturopaths I'm thinking of, they charge like $2,600 and it covers so many visits and labs and so on and so forth,
right,
right?
right,
And so that's kind of like their ticket. And they want to go higher. They want to be able to sell them more services, but like it just becomes cost exorbitant after a while. So,
right. Yeah,
but with them getting the money back, because literally that's one package, and then we'd meet the deductible and get their money back. Is that kind
right.
of the way it works, or would that
Yeah, kind of like
would
if
that
you
work?
go high, like once you've reached the deductible, right, then that's it's. And we have naturopath in our group, and the referral also, if they want to be referral partners, they can get compensated in 4 different ways. So just with that, just through referrals, they can increase their income and put that back into their business. Because there's also for each customer that joins, or each customer they get paid, and that's like in the referral program, and it's residual. There's like a bonus, and then there's residual. So for the lifetime of the customer, as long as the customer stays with Impact, they get paid for that. So,
Gotcha.
and
Okay.
that's powerful. It adds up. If you have 100 customers, that's just like it can be like 100 customers depending on also their plan, if they have a single or like what plan they have. But typically it's like that could be like $8,000 in residual a month,
Gotcha. Okay.
just
Are
in
you?
residual.
Yeah,
Yeah.
I mean, because there's a lot of groups too that probably you could get involved with as well. I was just thinking, like, because a lot of our coaches and consultants they run groups, and so they have like
Mm-hmm.
networking groups, so they have like this type of stuff, like Nick's doing and everything, and they probably don't have a connection that does this,
Right.
so it would be a great opportunity for them to say, hey, let me place myself in like as they wouldn't want to run the meetings for sure, right? Because
Yeah, well, they
they have
don't
enough
they don't
work with
have
their
to. They
primary
don't
care,
that's
but
the thing. They're so busy there, and we know how that goes. They're so busy, but they refer, and then I do the meeting. Oh, like I work with a group too, and
oh, okay.
like in Houston, I have also like a guy, and again, this is not just healthcare because we have other services as well. And next year, as of
Sure.
next year, we'll get into fintech, like I said, like technology, and also car and auto, which is also you don't need licensing for that. And so I mean, if you and that's the thing about a customer. If you already work with somebody, it's
Hmm.
you already have that connection, and it's much
Sure.
easier to help them share. Like, hey, do you need car? What about your home? Like, do you need insurance? And I can offer that as well, but I don't have to be licensed because it's lead pass. So I work with the people who offer that. So that it's just like a huge opportunity to also help with other services.
Gotcha.
So that's why I also like for you to see the whole picture, because again, this is just one service, and this is one, and it is my main focus on healthcare, because I see, and because I also want people to be healthy. I'm like involved in superfood movement, so with superfood and just holistic, and getting the root cause to the root cause
Hmm.
of the problem instead of just curing the symptoms. That's what the health system does, but there's so many other ways to get well without the health system. I mean, that's the truth. And so yeah, I'm also in many different groups, but connecting. My challenge sometimes is connecting all this, right? Because there's so much going on. And Zoom is the only way, because you can do in-person meetings, which is great, but
Mhm.
you only have, the day has 24 hours. But if you have the
Right.
power in numbers, if you also go to a larger group, you have, and with Zoom, to me, Zoom is still the best way. I mean,
Yeah.
most people
Well,
after COVID, most people know how to actually watch Zoom. I mean, they don't not have to do the presentation, but watch Zoom, and even doing the presentation is you can learn that, and like you're teaching that. I
yeah.
mean, and that's
Well,
I
yeah,
love.
that's the thing is like this is the way I kind of put it, right, Tina? Like say for instance you were like presenting to 100 people in a room, right? You might say, hey,
Hmm.
like what's your biggest health challenge, or what's the biggest thing that you're concerned about with healthcare or whatever. You're going to get response from the first maybe 1, 2 rows, right? But like the person of way back, they can't hear you, right? And I'm not saying that I'm not saying that online presentations are particularly superior, but the thing is that literally everybody that's on Zoom, right, is in the front row,
Right, that's
right? So
true.
like if you're visible and you're staying connected with them and you're, you know what I mean, and you're able to present at a high level and really just, emphasize points and be like, hey, you know what, guys, like I really want you to pay attention, that maybe you're training your team and you're like, hey, I really want you to pay attention to this very, very specific point. Like this is, guys, this is 99%, right, of everything you need to know. This is the biggest, most important thing, right? And you can emphasize that to them
Mm,
right there without losing connection
right,
on the call, right? And if you want to
right.
emphasize it more, you can make the slide bigger, right? If you want to,
Hmm.
go to a draw screen, you can do that, right? But at the end of the day, what you're doing is you're preventing that little talking head in the corner where people just do what most people do on a Zoom's call.
Right, exactly. That's why I always encourage, please be in a safe place, no
Yeah.
driving, because with driving, you don't, I mean, my presentations are usually just like, this was the specific one for impact, but just the business presentation, that's 10
Yeah.
minutes. So if you don't focus 10 minutes, you don't get it. It's like you need to be present, and
We
just for
teach
10
our
minutes, time
Yeah, we
block
teach our
10
clients
minutes.
to kick them out if they're on the phone. We do. It's not to be a jerk, right? It's just to be like, hey, look, we want you to get the most impact out of this. There's going to be some special opportunities for you on the call and everything. And unless you're engaged, you're not going to be able to take advantage of it. So I don't want
Exactly.
you hunting for the chat on your phone. I don't want you doing all that stuff, right? So like if you can't be here and present, that's okay. We have another webinar that's going to happen in a couple of weeks. You'll miss out on
Right,
what we were offering on this one,
right.
right? But
Yeah,
in 2 weeks, you get another opportunity to
right.
participate. So, thank you so much. But if you join with your phone, we just want to let you know we're going to kick you out, right? So
Okay,
that sets the tone and makes you the authority, right? Because at the end of the day, this is your classroom. So you got
right,
to control it, right?
right. Yeah.
And those are all kind of techniques that we teach our clients. We teach them how to, hey, this is how you save the chat. You get everybody's stuff. How are you following up with people that were in your presentation? A lot of people they don't follow up with them,
Yeah,
right?
that's
They
another
don't have
thing.
a
Yeah.
they don't have an engagement they don't have an engagement plan, right? And it's not just about, hey, let me talk to you about, health sharing, right? It's just like, hey, we're in a group, can we have a conversation? I would love to just get to know more about your business. I know a lot of people. How I want to see how I can serve you. Let's connect on LinkedIn. Let's, you know what I mean? Hey,
Right,
I saw that you like blueberry pie. Let me go ahead and shoot you an email about blueberry pie, right? Like
right, right.
whatever it
Yeah.
is,
Yeah.
but having
Right.
having a strategic plan to follow
Right.
up, to build and warm that relationship, because they already listened to you for an hour.
Right.
So give them 30 minutes to talk about their business,
Right. Yeah. And
right?
that's a concept of sharing. So, and that's a
Yeah.
concept that, like I mentioned before, like at the beginning of our presentation, this is like how we make it cohesive and we go deeper. We don't stay on the surface, because a
Yeah.
lot of people, they do the Zooms, but it's just like, yeah, and then again, you have the
Yeah.
black
Little
tile.
talking
It's
head in the corner.
like,
Yeah.
yeah, and that's why it's like, okay, when I do Zoom, okay, I mean, I don't have that policy, okay, no phones, because a lot of people just like they're out and about, but they need to be stationary. No driving, no walking. Just
Yeah.
sit down and watch the information and be in the picture. No black tiles. Like
Yeah.
if you yeah,
Yep,
unless you
exactly.
know
Be in the
them,
pictures, be on the thing.
right?
Yep,
Yeah,
exactly.
because we
Well, and
want
that's what
to
I'll do.
know.
Because I get that pushback a lot of times from my consultants, and I go, okay, great. You want to not limit phones. You don't want to kick people out. You don't want to be a jerk. Awesome. Okay, this is what I want you to do. What I want you to do is for, for the next 10 presentations, I want you to actually track how many people you close, right, or partner with that join from a phone. This is the number that you will see every single time. And the reason is because they're not, they, even if they are on the phone and they're staring, they can't see all the visuals. They can't really connect with you. It just doesn't work. So
Right.
I've proved that. I've done that to 25 coaches, and all 25 of them have been able to verify they don't get any sales from that. So if your job, if your idea of marketing is to share wonderful, impactful information and not actually get anybody to make a change in their life, then great, do that. But if you're
Right.
actually trying to create impact and you're really trying to create an opportunity for people to actually see the path forward, then you do it the way we tell you. You know what I
Right.
mean? And it's like,
Yeah. Yeah.
and it's not
And that's,
mean, it's just straight up like, hey,
no,
you know
but
what?
that's
No
the truth.
worries.
It is
Yeah,
the
it's
truth.
the truth,
And
right? And
I
so,
can definitely verify that because like I mean I've done a million, I've done a lot of Zooms, but it's true. I mean the number of people that actually get started or do like unless they follow up and you have a Zoom with them like in
yeah,
like stationary Zoom, not on the phone, but or have a conversation or meet them in person,
yeah,
that's how it works. That's why also we have a lot of in-person meetings now that because then in person it's a different story, like in smaller groups, like 10 people
yeah,
maybe. So in smaller groups, and then they have their network. And but again, if you're in a place like Dallas where you have to drive just from one part of town to another in an hour and a half, you don't find people gonna like you. I mean, those super leaders are very, very scarce. Like somebody who
yeah,
like sees the vision and wants to drive 3 hours back and forth. I mean, there are people like that, but they're very rare to find, you know. So,
yeah,
so in that case, I mean, the Zoom is just the best tool because I mean, you meet once and then you do the rest on Zoom. So I feel like that's the best way that you eventually you need to meet or it's great to meet in person because that way you
yeah,
go, wow, this is like you get the vibe, you get the energy. But on
yeah,
Zoom, you can also get like at least 50% of the energy of the person. So you get a feel for okay, I
sure,
think we yeah. So like coffee Zooms, I love coffee Zooms, just one-on-one coffee Zooms. And
yeah,
but again, it's a time restraint because you cannot do Zooms all day, and also life happens, and you need to do other things too, and
yeah,
other take care of a business. So you want to optimize the Zooms to have at least a certain amount of people on the Zoom when you do a presentation, and that's why also probably what your coaches try to achieve to have like a large
yeah.
group to invite
Yeah,
and
most of my
actually make
coaches are
sure.
really, yeah, most of my consultants are very successful and they do a lot of one-on-ones and they're kind of like blocked and limited by their time, right? And so, we help them to, okay, let's convert this to a one-to-many situation. Let's make it more effective. Let's make sure that, and that's why we have our little quirky little rules because we're like, look, we want to maximize your time, right? And so we don't want people getting on your calendar that are going to waste your time or don't aren't really there for you to understand you or help you or in any way or shape or form, right? And
Yeah.
so, and then we talk about like, hey, networking. When you're networking, it's not just prospecting because that's just 1/10 of like what's possible with somebody. Like I may be a great referral partner for you, right? I might be just an
Yeah.
advocate. I might be just a friend. I might be an
Right.
advisor, right? Like you
Right.
never know. Like I
But
might be
just a
somebody you
customer, I
hire,
mean,
right?
exactly.
Yeah,
Yeah.
you never know. And so when I'm always telling my coaches, like, hey, if you're getting on a one-on-one and you're going to spend that time, spend your time wisely and make sure that you're understanding that it's not just about selling, right? Because if they're on there to just pitch, if you're just on there to pitch slap somebody in the face, then you're missing out on 10 other things that they could be for you that could be even more powerful than just being that one-time sale, right? Like
Right.
if they could be an advocate for you, if they can introduce you to a whole group of people that are completely outside your network and get you like 10 sales, isn't that more beneficial than pitch slapping them and forcing them into something now?
Right.
Much more beneficial. So I
Yeah.
help them to get through that so that they understand because
Hmm.
they're used to closing that business, and that's how they got to 35 people,
Right.
right?
Right.
But like they can't do anything else because they're busy with 35 people,
Right.
right? Doing
Yeah.
the one-on-one coaching.
Right.
So
Exactly.
yeah,
Yeah.
so
Yeah.
we love doing what we do and stuff like that. But yeah,
Scaling and
I'm gonna
duplicating.
so I did invite one of the persons to this call. His name is David Cruz. He's my partner in another business called Total Metabolic Solutions, and
Mm-hmm.
he's a nutrition cycling therapist.
Okay.
So we have him set up with financing and stuff like that, for his patients, but it still might be a good add-on for him. And then he knows a ton of healthcare providers here in the area that he can
Mm-hmm.
probably link you up with as well. So I think he had to drop off the call. So I'll follow
Yeah.
up with them and maybe
Maybe
we
we can
can
do a three also like because
like a
I
three-way
like to
call. Yeah.
introduce it to JT Thomas that I work with in Dallas. I mean, he's
Okay.
also like he's been in this business for 17 years and he's a great coach. I mean, he's all like in coaching and training, but he's also like he was a healthcare not an insurance agent. So he knows also the difference and he knows all the details and he's like also about the scaling because that's part of our business and the compensation plan on how to create the residual. So like just talk a little bit more about the business model and just to have him also as a reference. I mean, in Dallas this weekend we have a live and it's like a conference with the founders of Impact. So they're going to be there. Of course, that beats everything else, but not everybody can be in Dallas on a
Right. Yeah.
Saturday.
Yeah.
So
Yeah,
and it's
I
not
think at
there's
the
no
at the
recording.
end of the day, if like he had a relationship where he could just be like, "Hey, introduce you," you know what I mean, or
Mhm.
whatever, and maybe if there was something tied to that, I don't know. But I'm sure you have. It sounds to me like you might have a referral program of some sort, which is great, and an
Right.
opportunity for them to make extra money, which would be
Right,
awesome as
exactly.
well.
Yeah, just
So
refer. It may not be for you. That's why I tell people, this may not be for you, but you may know
yeah,
people that are looking for something like that, and
yeah,
not like a quick fix, but something long term. And
yeah,
that's what we have. It's long term. It's not just quick or like one time commission or stuff like that. So it's really
absolutely. And then you have let's see here. I think I've got everything here.
yeah. I got your
Um,
number, and then you maybe shoot me an email. Let me can I put my
Yeah.
email?
So it looks like I can't interact with these messages on the current chat. So
Yeah, because we're in the breakout room. I guess that's
okay.
why.
Yeah. So yeah. So my
Well,
email address is will at BSG Connect. So business center.
BSG.
Yep. Connect.com.
Connect.com.
Yep.
Yeah, and also
And
you never know, like also with people, like because my son, I'm always thinking also broader because my oldest son went to MIT and he builds robots. And he's 24 and he has his own company building robots, vending machines and things like that. So I
so
mean,
cool.
and he's in Boston and I was like, we should also not just stay in one place. You need to think bigger, like not just Boston, but there's more. And also with the people, the circles we meet, there may be also a right person. Somebody's looking for a vending machine, or somebody is looking because they customize things. They can build things according to like they build like an oven for like a chef who needed for special chocolate. He needed this oven, so they built that. So
Hmm.
again, that's also things that sometimes it's kind of off the wall, but then it's like that's how connections work.
Yeah.
And I always find it very amazing, but you have to be open for it. And that's the
Sure.
main thing. You have to be
Yeah.
open for it and no limits, because you never know. And like you said, I love that don't think of the person just as one thing. You're like there's a whole universe and you just
Yeah.
need to find how can we connect and what would drive us most, but then just keep connected.
Yeah.
And so
100%. 100%. Yeah.
yeah,
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 definitely. If you want to shoot me an email, add me to your stuff, happy to kind of review it, check it out and all of that
yeah.
stuff.
Yeah, and how does your program work? Like, do you have is there a 10 hour like a limit or is it customized? So you charge by the hour or you have like a package or how does your program work?
Yeah, so
Like,
typically what I do if there's like kind of interest or whatnot, we'll just sit down and kind of like talk about like kind of like because I need to know like, hey, what's your lifetime value for your clients? Like, how do you make money? What are your packages? What is everything that you can sell? Like, how can we create something along that lines? I need to understand like kind of like what your technical aptitude is because some people are really good with technology, some people are kind of mid, which that's normal, right? And then there's people
right,
that are just completely like, hey, I can't do anything. I can't even open
right,
my email, right? And so
right,
like we can't it's difficult to work with those people because of the fact
Right.
that, you know, there's such a large training curve. So I'll typically just recommend that they go check out YouTube for a while and get improvement, right? And then open
Mhm.
up a Canva account or whatever, or Gamma or whatever, and just kind of give them some resources to go from. But
Mhm.
like, but yeah, typically what I do is I kind of go do a deep dive, we kind of see what's going on with your business, and then I make a recommendation based off of that. So not everything is bespoke because we have frameworks, otherwise it would take forever to do stuff, right? But like
Right.
the frameworks that we have are super powerful for people that are, you know, really out there trying to do it. And typically, I mean, we work with coaches that are, you know, like I said, it, they're making about 20, you know, 20K a month or whatnot, and
Okay.
we can usually take them to like 100K per month pretty
Wow.
quickly, because we systematized everything. We do everything for a reason. You know what I mean? We want you networking, capturing chats, following up with people. I teach you all of that. So like it's
Okay.
the revenue goes. You know what I
Right.
mean?
And do you
Because
have like automated system? Because that's my
yeah,
main, honestly, that's my main challenge because I have all these contacts. I have like 4,000 people in my phone. I have like 8,000 on LinkedIn and on Facebook, and but they're all different and they're different groups and they're
mhm,
not homogenous. They're like absolutely diverse. But they don't, a lot of times I don't know how to stay connected with them, you know, because
sure,
I don't even remember like, oh, I met this person. Of course, I like the human touch most, but
yeah,
then again, even with the people that are, wow, this guy had such great energy, but now I forgot his name. So how do I find him again? Like, just like being, like you mentioned, scalable and
yeah,
being like following up. And I know there are systems like CRM systems, but everything
mhm,
I've seen so far, it's for realtors and they use all kinds of systems and you pay all this
mhm,
money and then at the end of the day, I see that a lot. They don't really utilize it, or I know I would probably not use because it's too complicated. Because
yeah,
I'm also honestly I consider myself low tech and not really high tech. But I'm
mhm,
you know I've learned. I'm willing to learn, but I just need to know. Okay, how can I learn this quickly? Because I have no patience. Like if it's
yeah,
gets too complicated, it's that okay, I'm out. You know, just can we do this
yeah.
quick? Yeah, quick. That's my thing.
So
Yeah, I don't want to
it's so
waste my
funny
time.
because like I get that all the time, and we really do make it stupid. And the reason that is like I'll be like, okay, you're on a networking call, one-to-one networking call, and they booked on your calendar. Well, you already have their information or CRM. So I go and just be like, all you have to do is open up the contact while you're talking to them and add their and put a tag on them, which is basically it's already predefined, and all you do is you tag them with that workflow, and then they start getting the emails for you. And it's just like I showed this to a guy yesterday. He's a tech guy, by the way. He's like, "Do you have a Loom video?" I'm like, "You don't need a Loom video." He's like, "Well, why?" I'm like, "Okay, let me show you." Boom, boom, boom. He's like, "Oh my God, that's so easy." I'm like, "Yeah, I know. That's what we do for you." And then if you, let's say, for instance, like you don't call them, right, for some reason or whatever, and they stay in a pipeline step for too long, guess what's going to happen? You're going to get an email saying, "Hey, you need to call your leads," right? So everything is baked in. And
Mhm.
we have pipelines for your vendors, your strategic partners, and then also your salespeople. So, like at the end of the day, you know where everything's at, and everything is happening automatically for you based off of stages, which is way different than what a lot of people do because, like, the way they program it is they usually make the CRM the big shoebox, right, with business cards in it,
Right.
and they
Exactly.
don't do anything
Exactly.
with it, or they do
Right.
mass emails once in a while, or they do a monthly newsletter, which nobody cares about. So,
Exactly. I mean, it worked in the 90s, like when I was still
yeah,
where I mean, I created stuff like that and but then now, I mean, forget it. You know, it's like nobody really reads they go in the spam. That's mainly what
yeah,
it is. People
yeah,
don't read email.
exactly, exactly.
So
And
yeah,
plus, you're only giving them one way to interact with you. Again, you're missing the point, right? Because like, hey, the only way to interact with me is to buy what I have or read my crap, right? Is versus being like, hey, you know, leave me a good review. Did we have a good one-on-one? Did you learn something when you talked to me? Could you leave me an endorsement on LinkedIn? Right? Hey, do you think that I'm a cool person? Do you think other coaches and consultants should know me? Would you do me a favor? Would you refer somebody to me once in a while? Right? And so your communication is set up to where it actually means something when they get it and they have an opportunity to help
right.
without putting you in the situation where you're always trying to pitch slap them and sell them.
Right. Because
So
I
we,
also
we do that stuff.
that's another truth. Like people know, you know, like or they have a notion, okay, this is you're selling something. I mean, I'm not
Mhm.
selling, I'm sharing, but it's basically everything we do is selling. I mean, if you look at it from that
Yeah.
side, you know, like you're telling your story, that's selling. So somebody else is doing the selling. Or, I mean, I don't like the word selling, it's sharing, because we're humans. And so depending on, like Jesus was sharing, I mean, like everything is sharing or selling, depending on how I look at it. It's not nothing negative, it's positive. That's what we do as humans. But
Well,
then
and
these
that's the
people
thing.
have these, yeah,
That's
go ahead.
that's the other thing. Like I'm saying, like, hey, you know what? I'm going to take an hour of your time, right? Your time's valuable. So my responsibility, right, for taking an hour of your time is to do what? It's to create an outstanding experience, right? So if I can
Right.
create an outstanding experience for you, right? So an outstanding experience, right? But
Okay.
here's the thing, right? If I want to create an outstanding experience, you know, I have to have great content. Well, like we talked about, everybody's got great content, right? So, but if I have great flow and I can bounce back and forth and then do all the stuff that I showed you, right? And I have a great way of delivering that content, meaning that you can see me clearly, you can see that I'm a real person, I'm not just some talking head or some sort of AI avatar, right? Then that allows me to engage. And what we do here is we connect the dots between all of them so that you can deliver that outstanding experience, right?
Right.
So that's very much what we try to do for our coaches and our consultants, because we want you to be able to do that, right? Like, why shouldn't you be able to do that? It's
Right.
ridiculous that you can't, right?
Right.
And I work with consultants that are working for companies and they have, like, they're getting paid 250 grand a year and they can't present at that level. I met a person that, you know, coaches people on how to do webinars. She can't present at that level. And I'm like, well, that's ridiculous, right?
Right.
So again, with the right tools, right, and the right coaching with regard to those tools, you can be very successful at doing this. We have a guy, he's one of the top guys in LifeWave, and you know, we work with him, and that one's more like an network marketing thing. But you know, he was able to retire. He was actually a doctor. He was able to retire this year because of our help. You know, and that's a
Yeah. I
godsend because
mean,
his wife was getting
yeah,
tired of him running two businesses.
absolutely. I mean, and also there's nothing bad about network marketing. I mean, also that's what my business, I want to be more efficient with that, like also in my superfood business and in my other businesses, because I can't be everywhere, but I want to have that presence so people can find me and see as a referral and whatever it takes. Like, because I've been doing this and I'm really passionate about it for 6 years now. I mean, because again, like after television, I said I'm never ever going to work for anybody else. Like corporate television just kills you, kills you. Right? Yeah, it's so toxic, it's so negative, and it's always the boss. That when they talk about pyramids, that's what a pyramid is. Like the guy on the top, you know, you can only get up if somebody dies or whatever. So it's like, no, I don't want and nothing like that. I want freedom, and that's why I moved to Texas to have that freedom. But now it's like, okay, how do I make it work? I have all these elements, but I feel like there's a missing link. And so just to get it, and that's the scalability, and that's also the automation and the presence. I mean, social media presence, I'm not really focused, and there needs to be more like presence, but in a focused kind of way.
Most
So
of our coaches are the same way. It's roller coaster. They get really focused on it for a while, and then it goes down, and then they get really focused on it a while, and then it goes down. It just it happens because you start getting business, and you're like, okay, I'm going to focus on the business, or you get a new person, so you got to train the new person, and next thing you know, it's just like, dude, I'm not posting anymore. Now I lose momentum. Now it's go back, start networking, and so this is back. That's why we do what we do, because we're like, hey, let's do it consistently. Let's do it this way, you know, and then I hold you accountable. So the other thing too is like, I'm literally going and being like, hey, you got 15 referrals this week. How come you haven't called them? Right. I have, you know what I mean? Because I can see your stuff. So I go, hey, you know, what's going on here? What's going on here? What's going on here?
I love that scalability.
You're like, wait a minute, dude. Like, what are you talking about? Don't I pay you? I'm like, yeah, you pay me to make you successful. Right. So that's the whole deal. But
yeah. Again, like call them and not wait. That's also my, like, I have all these business cards and all these contacts, and then it takes me like a month to call back, and they don't remember that. You really have to call them back right away, and then just invite and see, okay, can we work together like right away, and not just 2 weeks later or 3 weeks later, because then I mean, you can reach out to them, but it's kind of okay, so why does it take you that long? And do you really, so the sparks usually are gone because they can't
Yeah.
even remember who you are, right? And I can't even remember who they are. So like, why am I wasting my time going to all these networking meetings when
Yeah.
I'm not really cashing, I mean, not cashing, I don't like that term, but utilizing our connection and
Right.
finding out
Yeah.
more. Maybe this is, I miss the person of my life just because I don't follow up. I mean,
Yeah.
that's that thing.
Exactly, exactly that. And then, like I said, it's time, right? Time kills all deals. It's on to the next for most people. And so
Yeah,
again, you're absolutely right, right? If there's a connection and you can say, hey, let me get you on, let's get on the calendar right now. Like, let's do that, right? Because
yeah,
at the end of
right,
the day, you're like, look, you have some sort of interest in what I'm doing. I want to take advantage of that, or not take advantage, but I want to see where that leads, right? Maybe it's just
right,
like I said, it's a referral source. Great. I'm going to set you up on my referral program, make it easy. And that's what we do. We make it super easy because it's just like, hey, you want to be on my referral program? Great. I'm just going to do
so
this. You get an
so you
email. You
have
get the
that, like
email.
you have a
Great.
special
Right.
category for referrals, so like
Yep.
in your system.
Yeah, we break them all up, right? And so the reason that is because we want to make sure that, you can silo people in there and then they can get the right communications based off of what you want to do, right?
Right,
So like this
right. And
co-marketing person.
then you can also follow up with them because then maybe they're at some point they don't want to just be referrals because they maybe it's time for them to join your
Yeah.
team on a different level because things
Yeah.
change.
Which is why we tie in, hey, get on my schedule once in a while in a lot of our workflows. So again,
Right,
you
right,
want to make sure that, like you said, you're going to communicate with a vendor way different than you're going to communicate with a co-marketing partner. But usually what people do is they program a pipeline and it's sales. That's it. That's all they do.
right. Yeah,
So if that's all you focus on, that's all you get.
yeah,
And really without a system, if you are making sales, you're really just lucky. You know what I mean? Because you're
right,
not really cultivating the relationships,
right.
right? And so
It's
that's
true.
kind of the thing. People talk about nurture sequence. And so it's like, okay, what's your nurture sequence? Always newsletter, you know what I mean? Whatever, right? Like it's so terrible. Like you're just like, what are you talking about, dude? Like there's so many other things that somebody can do to help you with your brand and help
Right.
you with connecting with people. Why aren't you taking advantage of all that? That's what we do.
Right. Well, that's really cool. And yeah, like yeah, let me give me some more info and send me some more info. Like you have probably also the
Sure.
website and
Like I said, yeah, it's bsgconnect.com. But the
okay.
best thing to do is to hop on a call. You know what I mean? I can take you through it. I like I said, I got to know like a lot more to understand like
Right.
kind of where your
Right.
main pain points are. But most of what you're telling me is kind of the same thing. Have a huge network of people that are completely inactive and they can't really articulate what I do. Right?
Right.
That's normal. Like my brand is inconsistent. I don't have my brand aligned across all my platforms. When people book an appointment with me, they're getting stuff from Calendly and they're not really, you know what I mean? It doesn't look good.
Yeah, I mean
Right.
that's me. Like I was like I need to set up Calendly because how can I like keep control of all the meetings and then I'm
Right.
driving. I'm like on the road, but I mean you can check in with that if it's on your calendar, but if it's not on your calendar and then you miss it. So
Yeah.
Calendly is actually great. It would be a great tool, but I haven't even set it up yet. So that's that. I mean,
Yeah.
there's so many elements of it. Yeah.
So many
So
elements. And yeah, but yeah, the best thing to do is just to, grab some time on my calendar. Once I get an email from you, I'll go ahead and send me your one pager and all that stuff. I will go
right.
ahead and send you my calendar link and we can hop on a call. If
Okay.
for nothing else, you're getting to know great people in the area and you probably know consultants and high ticket coaches and people like that. So I'm
Yeah.
always
Yeah.
willing to take some time and, give you some
Yeah.
good
And
advice and
learning
give you
from
some
each other.
good,
Like again,
yeah,
even if they, I mean, I know the LifeWave people, I know like all these, I mean, I'm in the network marketing space, so I know a lot of these companies. Purium, probably heard of Purium.
I haven't heard of those.
It's superfood, and they all have the network marketing structure. But that
Sure.
doesn't mean that you have to still establish because you're on your. I mean, this whole thing with upline, no, it doesn't exist because I'm the teacher, I'm the coach, I'm the mentor. I'm nobody's upline. And that's also the culture that I want to create. I'm my own individual. So you
Yeah.
may be in some kind of structure in a company like that, and they teach you, they have great mentors, but you have to make work what works best for you. even though their systems, I mean, it's all, everybody has a system and the system in the box, but still it has to work for me because I have different other companies. So I'm not going to commit to just one company that does the network marketing thing in their way. That's not, to me, that's too limiting. I have bigger visions. You know, I'm my own brand, and I'm not like attached to any of these because I utilize them. I utilize those systems. I love that. I utilize, but I'm different. I'm not, you know, because you can't really scale. I mean, you can't really duplicate me, and I mean, but you can duplicate my way of working. That's my goal, to find that system that I can teach or share, and it's very simple, and you don't have to be me or like me, but it says it works. So that's that, like, I can help you to be successful. So that's kind of also my goal. So and yeah, and whatever it takes. I mean, I've tried a lot of things, but for example, the NEPQ, which is, I don't know, you may have heard of that, like it's not, it's just,
The
and to
no
me,
guy, lots of
yeah,
questions. Yeah.
it doesn't work for me. This stuff doesn't work for me. It's too, it's really, no, that's not me. I went to their workshops and their coaching Zooms and all that, and it's just too shallow. It's just no. And it's also, like you said, it's not personalized. It's just like, even though they have the different industries and they teach you, or they supposedly teach you what in which industry, but it's not a good, to me, it doesn't work. So I have to look, that's why I keep looking. Okay, what else can I do to scale my time? Because I only have limited time and I still want to have a good life. I mean, that my life where like I need to be out, I have to have my time, me time, family time, all that. So I need a system that I can feed and just put something, but that it works automatically. So that's my vision too. Like with all the social media, the AI and everything that's going, and the CRM and all these systems, there's got to be a way to make it simple where I don't spend like 10 hours a day just on the system, but can concentrate on meeting people and on growing relationships.
Yeah, and that's in line with what we do for sure. So we'll I'll get some ideas and everything together
Awesome.
for you,
Yeah.
and love to, sit down with you. And like I said, if there's there's three types of coaches that, or three types of consultants that really kind of like partner with us. It's like we have the person, like I said, they're kind of an observer. They take a couple of great ideas and they kind of try to implement them. And usually what ends up happening is they come back a year later and be like, I wasted a lot of time. Can we do this? And then I have
Mm-hmm.
like people that see it right away and they're like, let's go. Right. And then I have
Mm-hmm.
people that actually partner with us and are like, hey, look, I'm gonna be advising other businesses, and so I want to be a partner with you, and so we have a program for that as well.
Right. Yeah.
But
Yeah.
yeah,
That's definitely
we'll talk
schedule
more
a
about it.
meeting. So, and I can show you also like my presentation, how I present
Yes.
the business. Usually
Yeah.
that's like my main business. I mean, there's the other businesses that I can also present, but like this is like my focus on my main business because it has the most fruit. That's the other thing. You go where the most fruit are, and then everything else should be around it. So keep the main thing. But again, I'm too much of a maximalist to just keep one thing. I have too many other things going around, but I believe and I know that it can be integrated because that's in it, but it has to be customized to me and not to
Yeah.
some system or something else. It has to be my system that's organic and that I can actually feed. Right.
Yeah.
So
And that you enjoy, right? Because you know what's
yeah.
happening with it and you understand it and all of that.
Right.
And that's the big
And
thing
that
too.
creates
So
also because my vision and mission is for generational wealth. I mean, that's the main thing. I mean, I'm not doing this for myself, but for everybody that they can see that too and do that use those tools for themselves and then create generation because that's what we're here for. I mean, it's not to sit on it, but to share it and to create prosperity that other people can also create and share and put it
yeah,
back
you got to
into the
break free of the
community.
matrix sometime, man, for
Yeah,
sure. Right? Like
absolutely.
and that's why I told, I talk to coaches all the time and they talk about like, hey, I'm trying to set people free, right? Because we're all trained in the same, classrooms haven't changed from 100 years. I don't know if you know that, but if you take a picture of a classroom, 100 years ago and you look at a picture of a classroom today, it's exactly the same, right? Like
Right.
we're still being trained to follow orders, to raise our hands, to be quiet until called upon, all of those things, right? And so, entrepreneurs, coaches, people that are dedicating their lives to actually creating that type of impact, they're really trying to help people free their minds And I talked to a coach one time. He was just like, I was just like, why doesn't everybody know this? He was just like, quite frankly, if everybody knew it, there would be nobody to work, right? And that's true. It's 100% true. If everybody was free, who would work? Who would do the work? Who would be there to serve your burger, right? To fill your coffee, right? To do all the things. And so it's closely guarded by a lot of people how to actually be successful. We don't do that, right? So like, what we're doing is we say, okay, let's teach you how to be successful at doing this, right? And stop wasting time. So yeah, I'll I gotta jump to another meeting, but
me too.
So nice
but I'll send you my email and then we go from there, and it's something like a little more
spam
like
me. Go ahead, add me to your stuff. Spam me.
Okay.
I'd love to do it. Connect with me on LinkedIn. All right.
Okay. Awesome.
Right, sounds
great.
Thank you very much.
Great meeting you, William, and we
Great
keep
meeting you too.
moving forward on that. Okay. Have a great one.
You have a wonderful day.
Okay, you too. Bye. Bye, William. Bye. So now let's get out and close.